Hello, everybody, and thank you for joining us back here at Entheon Biomedical's channel. We're sitting here once again with Tim. And Tim, it has been a while. You've had a lot of exciting updates. How are you holding up over there?
Busy, 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 but yeah, a lot of exciting things we've been working on.
Perfect, perfect. So let's dive into them. You guys got DMT updates. You also have another recruitment underway for a trial touching on ketamine on neurological activity. First and foremost, give us the 411 about that. That's new grounds for you guys, isn't it?
Absolutely. Well, it's a continuation of a thought process that we've had for a long time, where we understand that psychedelic drugs obviously have this huge potential to be super affecting in terms of treating a multitude of mental health and addiction related issues. But there is some ambiguity as to, hey, what psychedelic is appropriate for what individual? And so from very early days, we've been focused on the development of biomarkers to assist physicians, give them some visibility into this often murky world of just purely subjective measure. I think as we both understand and as listeners understand, psychedelic drug experiences are very difficult to characterize. This a realm that has eluded, philosophers, poets, and artists for decades, if not centuries, millennia probably. So one of the areas that we're interested in is better characterizing from an objective perspective what actually takes place in some of these very difficult to capture drug experiences. And so, we understand that DMT is probably, in our estimation, the best serotonergic to elicit a transformational experience. But we understand that for different patient populations, with different psychiatric risk factors or with a different just user profile, certain drugs may be more appropriate for them. And so the basis of our EBIQ 101 trial is to better understand some of the biologics that associate the drug experience. And so the study is structured around an EEG analysis of patients as they go into the psychedelic or the ketamine drug experience, but we're also pairing that with our genetic biomarker test to understand if certain metabolic factors, as represented by different gene SNPs, have any impact from a subjective perspective, but also from an objective EEG perspective on the intensity of the experience. So there's a lot of data that can be squeezed out of this recording. We're going to be capturing people before, during, and then after the psychedelic experience, with the intention being to characterize the change that takes shape over the course of that treatment. So it's going to be 10 ketamine administrations. So we believe that there's going to be quite hopefully a noticeable neurophysiological change that takes place over time, but also in the actual instances of administration. We understand that within the ketamine space, there are certain thresholds associated with experience that are indicative of entirely different sort of realms of experience. There's that sort of uppermost threshold of a K-hole or a breakthrough. And then, of course, in the onset, there's a threshold of when a person is not experiencing the drug to when they are experiencing the drug, and the span in between. So, we're using this study to validate, to explore our genetic test kit to see if there are any changes based on certain metabolic factors, but also to better understand the ketamine experience and to determine what changes take place as a person moves into therapeutic effect. Not to belabor this any further, but we do believe that there's a very important measure that takes place that is representative of, hey, what does positive change look like? We think that'll be valuable for physicians to validate that, yes, something meaningful has taken place, and then understanding that the psychedelic psychotherapy paradigm has changed, where it's not just take two of these and tell me how you feel in 6 weeks, but rather it's going to be a multi-touch point, long-form type of patient care. That measure of therapeutic effect, we would like for that to be something that could be returned to in subsequent follow-up, so that physicians can validate that, yes, this person has achieved a form of wellness and is maintaining that wellness, or, hey, they achieved wellness, but now they're degrading in terms of their wellness. And that would just better inform how a patient has follow-up care and how a physician might monitor that. And we believe that for the administering physician or the clinic, that gives them a very valuable additional touch point against which they can modify customized care.
Yeah, Tim, kind of from the first part you said there, I think it is very important, as you had said, like, yeah, DMT, while having a lot of potential applications, let's not champion it as the only solution to the complex problem of humanity, right? So there are potential other ones. And what's interesting, this is kind of the same conversations we've had about DMT that you're applying to ketamine here. Let's take the mysticism where it's like, okay, there's some potential therapeutic value here. Let's remove that mysticism. Let's apply the scientific method to it. Let's get repeatable results from things and see what we can do with that and actually apply it. And this is going to be the things that kind of removes a lot of what is the negative connotation around these as well.
Absolutely, yeah. I'm all for, yeah, the world of mystical and sort of association with symbology and etc. But yeah, I think for us to move this world of psychedelics into a realm where both regulators as well as physicians are comfortable with it, I do think we need to arrive at a place of more objective reality. And of course, that doesn't take out of it's not like we're going to have AI and robots administering this and observing everything. Of course, that crucial element of sort of the physician oversight or the therapist report that exists certainly, but we're just trying to make their jobs that bit easier in terms of giving them beyond what their eyes and their ears can perceive, something that can actually objectively measure very important therapeutic or subjective states, so that they can know when it's appropriate to come in and stop, or come in and modify and give a comforting word. So yeah, the objective here is to just make the job of the regulators and the physicians that bit easier by giving them a greater sense of safety and security in terms of what they're doing as being both safe and effective.
Yeah, and that's a really good point. And while this is an arduous process that does take years, they're not just going to take people's word for it. So it's got to be done. It's a very important part of the process. So tell me about how things are going on the DMT side. Any updates there you want to share with people?
Yeah, absolutely. It's getting clinical trial in place and in order is certainly quite a complex undertaking, but we're happy to report that things are moving ahead as scheduled. We anticipate our clinical trial to initiate within Q1 of 2022, and it's a culmination of a lot of hard work. I think in spite of the unprecedented sort of environmental and just business environment effects of the coronavirus. We've been just so blessed to have such amazing partners that have worked through some of the difficulties. I think, at every stage of life, there have been friction as a result of understaffing, et cetera. But, we're super happy that, we're looking like we're going to be doing our phase 1 human trial in the early part of 2022, and so we couldn't be happier. In our estimation, it's the most rigorous study of DMT today. It's beyond just being a pharmacokinetic and pharmacodynamic study. We're taking into account a huge battery of neuropsychological and neurophysiological tests to better characterize this mysterious thing that is DMT. And we're going to be measuring the effects of that against hundreds of utilizing some of the technology at our clinical our contract research organization partner, measuring the effects of DMT against hundreds of other known psychoactives. But also, as we mentioned, sort of within the world of ketamine, deploying some genetic testing to see if there are any genetic-based variables that might impact subjective effects, but then also capturing that EEG data to the best of my knowledge, the sort of first type of study of its kind, measuring the EEG effects at various through the entirety of the DMT administration, trying to understand what the different levels of immersion, different levels of subjective experience look like. I think you and I both know that there are specific experiential thresholds within DMT that really change the game. And so, not to say that the sort of breakthrough threshold is something negative, but certainly it's something that a physician should be aware of as an individual approaches, because it absolutely changes the nature of expectation. We're attempting to characterize or to capture the data associated with these ascending dose ranges, to characterize where some of these important therapeutic or subjective thresholds may exist, so that physicians could better understand, hey, is a patient operating as expected? And do I need to modify anything or change anything to avoid them going into a place that they're not prepared to go? So again, in the interest of safety and the interest of just objectivity and empiricism, we've structured what we believe to be the most rigorous and comprehensive study of DMT to date.
Wonderful. Yeah. And like as I said, this is what it's going to take. This is what it's going to take to show people the true inherent value of it, which we believe in. And that's why you're talking about this. And I guess, Tim, last but not least, what are you most excited about looking at here? Like what is the thing that you are really looking for from this?
Yeah, no, obviously we're looking to prove this out as being safe. And I think that's the primary focus. Obviously, as much as we want to be on the absolute bleeding edge of things, the purpose of this trial is to establish that very important base data set that is in the form factor that we can present to the regulators as we pursue phase 2s and structure our clinical design on pursuing specific addiction indications. But yeah, I'm absolutely thrilled to be capturing some of this EEG data. I think there are applications within DMT that make it certainly useful for what we're envisioning to do, which is a real-time, super modular, customizable intravenous drug system that can respond in near real time to what is being observed. So it's super interesting for us to explore what these different therapeutic ranges are. We think that, the entropic effects may have additional applicability to other serotonergic psychedelics, such as LSD and psilocybin. So we're really eager to establish this base of this technology base and to establish some of these data sets using the best molecule that we know, with the intention or the hope that it is applicable to a broader set of different psychedelic regimes.
Wonderful. Well, Tim, I wish you the best of luck on your dive into the psychedelic frontier. Hope everything goes well and look forward to updates from that. Anything else you want to let people know? Anything else before we go?
No, just as they say, watch this space. We have a ton of really interesting things happening, both within the technology space as well as within our drug development category. Some very interesting things to watch here. So yeah, just watch this space.
Wonderful. Well, Tim, it was a real pleasure talking to you again. And thank you everyone for watching. Of course, any questions, don't be afraid to send them over. Stay tuned for another video coming soon. Tim, have a wonderful day.